Okay, so this is Natazia. It is a combined oral contraceptive, and combined means that it contains both progestin and estrogen. What makes Natazia different from other birth control pills is that the other birth control pills have around 21 active pills, which are pills that contain hormones. The last 7 pills are inactive pills, which reduce the hormone level to allow for your menstrual cycle to continue. So what makes Natazia different is that there are only 2 inactive pills here, which allow for the myometrium to contract and shed the lining of the uterus. So, chemical. This is estrogen, which is the common brand name for estradiol alert, and the chemical formula is right here. It's got 23 carbons, and it is 356.5 grams per mole. The second hormone is progestin, which is different from progesterone. Progestin is a synthetic hormone that's meant to mimic the effects of progesterone, and what it does is it maintains a constant level of hormones in your body to, prevent a pregnancy from taking place, which we'll get into later. Now, these are steroids. So steroids tend to have around 4 rings. These 2 steroids have 3 6-member rings and 1 5-member ring. Now, what makes progestin different from progesterone? Does anyone want to take a guess what makes progestin different? Progesterone would normally have a solid bond right here, but in the case of progestin, it doesn't. So this would be like a 19-mole chemical. So yeah, this is what a steroid would normally look like. Okay, so historical alternatives. This is the only one that's actually sanctioned by the Roman Catholic Church. It's called periodic abstinence, which is when you abstain from sexual intercourse until the period happens, which is when your cervix becomes less favorable to sperm, and when you're not ovulating, which is the ideal time to,
make a baby.
Do not.
Not make a baby, yeah.
The second. By the way, there are many historical alternatives. I'm just.
Are you about to go through the entire historical history of birth control?
Yes. But
yes.
Do it.
But he could.
Okay. Sorry.
I'll get into the ones that I think are really interesting. Crocodile dung mixed with honey, which is used in ancient Egypt. They make a paste and they put it inside the reproductive organ, and it would act as kind of like a spermicide. They're all dead now.
The reproductive organ of the man.
The crocodile?
Or the users.
Continued. Breastfeeding. Whenever you're breastfeeding, ovulation doesn't happen, so it only works for like 6 months after you give birth, which it's a very reliable form. It's a good form of birth control. It's very safe, but you can't use it every time. And you want to guess what this one is?
Yeah, let's
Interruptus.
Yeah, let's go ahead and leave it. Let's use the medical term. Let's use the medical term. That's great.
And believe it or not, it actually works if you do it correctly. Uses obviously prevents pregnancies, and what it does is whenever you take the pill, it tricks your brain to think you're pregnant, which means that it's going to prevent ovulation from happening. And another thing that the hormones do is it also thickens the lining of the uterus to prevent implantation from happening. And it also thickens cervical mucus to make it less favorable for sperm to swim through. So those little things that have to get into the pear-shaped organ can't get in because the cervical mucus is thick. Another thing it does is it treats dysmenorrhea, which describes menstrual pain. And one of the reasons why women have menstrual pains is because whenever you're shedding the lining of your whenever they're shedding the lining of their uteruses, the body produces this chemical called prostaglandins, which causes the myometrium to contract. The problem with that is that if your body creates a huge amount of it, it can start to cause cramps. So what birth control does is it also suppresses the production, it regulates the amount of those hormones or those chemicals in your body that causes your myometrium to contract, which regulates your pains. It also treats menorrhagia or heavy periods. So one example about how this can happen is if there's like a hormonal imbalance in your reproductive organs or reproductive system, it can cause the endometrium to grow, and it has to shed away by bleeding, and you might get heavy periods as a result of that. Birth control regulates it by thinning the lining of the uterus to prevent that to prevent heavy bleeding from happening, and it also maintains a constant level of hormones in your body. So, if a woman were to fail to ovulate, her body would not produce enough progesterone, which would cause the hormonal imbalance in the first place. Birth control, maintains that balance. And it also treats endometriosis. The reason why Natazia is more effective is because it has less inactive pills, though it is not the most effective, birth control option to treat endometriosis. I think the ideal kind of pill you want to take is one that completely stops your periods completely, and you all know what endometriosis is, right? What do you mean? So it goes in your endometrium, goes outside of your pear-shaped organ, your uterus, and the problem with it is that when the time of that month comes around, your lining doesn't have anywhere to go, so it can cause problems. Okay, history. Margaret Sanger coined the term birth control in the early 20th century and created the first birth control clinic and formed the American Birth Control League, which is like today's Planned Parenthood. She's a very good voice, I guess. So in the 1950s, so around the 50s, she met up with this guy named Pincus, who was a scientist, and she convinced him to create, to help her create some birth control pills. So what he did was he tested progesterone on rats, and then if it's proven to work, and then he did another clinical trial on women, and it also proved to be successful. So in the 1960s, the FDA approved of the drug for typical use. In 1957, it was only approved for medical use. In 1960, the FDA approved it for typical use. There's a lot of controversy surrounding this drug. A lot of abstinence-only speakers in the 80s were talking about how it would cause cancer. Pam Stenzel said you'll end up sterile or dead. That's not true. You're fine. You're not going to get. There are some side effects. There are some contraindications, which we'll get into later, but they're not as bad as anything. So, pharmacodynamics is defined by how it's. The definition is how the drug interacts with the body. So the hormones in the pill trick the brain into thinking that you're already pregnant, which causes it to constantly create progesterone and estrogen, which would prevent ovulation and all these other things, which would also prevent a pregnancy from taking place. And pharmacokinetics describes how the drug is distributed throughout the body. When you ingest the pill, it gets absorbed in the gastrointestinal area, and then it enters the bloodstream and it travels everywhere. Now, keep in mind, even though it's only supposed to supposed to affect the brain, it's still in your bloodstream. So it's other parts of the body don't know what to do with it. So it gets excreted mostly through urine. How it's made. So a synthetic powder containing estrogen and progesterone are mixed together and dried, and then a lubricant is added to it. Is added to the dried powder and used to create a tablet, which contains the ideal amount of hormones that you'll need to achieve the desired effect. And it gets checked to confirm that it complies with FDA regulations, and the quality control measures are very high. They're produced in sterile environments to prevent contamination. So contraindications, side effects. So you get weight gain, which is a small side effect. Irregular bleeding if you just started the pill. Breast size growth if the pill contains estrogen. So this gets really serious. If you're a smoker, it's recommended that you either stop the smoking or stop the pill. And